finding the balance between traditional Western medicine and natural alternatives is not as much of a fine line as I think a lot of people would like to think it is, because what you're doing through most traditional Western medicine, or the medicine that most of us are familiar with, you're treating acute problems most of the time. And I think that there's definitely a place for that. Where the natural options really shine is for people who are dealing with chronic illnesses, such as diabetes, heart conditions, high blood pressure, because getting to the root cause of those and being able to nourish your body in a way that allows for it to function and recover like it's supposed to gives that person an opportunity to maybe not resolve and come off all medications completely, but definitely lessen the burden. In terms of someone who is looking to perhaps try to come off of high blood pressure medication, if you're looking at the alternatives for that, what you want to do is make sure that their body's inflammation response is nourished first. A great way to do that is by supplementing with a high quality fish oil supplement. That's going to help your body do what it needs to do. What you're looking for, rather than an over-the-counter versus natural alternative, is what problem are you trying to solve and how quickly do you want to solve it. If you have a migraine, you're going to want to go with a prescription medication. If you have a mild headache, perhaps you need to think about, do you want to treat it with a hammer or with a feather? So do you need to down 400 milligrams of an over-the-counter, or do you just need to make sure that you're properly hydrated and that you've got enough salt today and you're not hungry? So there's lots of alternatives rather than just going out and grabbing the first medication that you can get your hands on to solve the problem. Is digging a little bit deeper. When you're talking about natural remedies, tinctures, herbs, and that kind of thing, people often think because it's not moderated by governmental agencies that it's completely safe. And while it's very hard to overtake an herbal tincture, you have to look at it as in terms of you have a diminishing return at some point. At some point, take too much of a good thing and start seeing the lack of benefit. So where do you find that sweet spot? I recommend starting slow. So let's say your tincture says take up to 20 drops a day. Start with 5. How do you feel? Are your symptoms resolving? If not, okay, let's take 6. 7, 10, and so on, until you find a place where you're feeling the benefit, you're seeing your symptoms resolve, and then stay there. If you get to a point where that's no longer serving you, then okay, do you still need it? That's the first question to ask, because you may no longer need that particular thing. The second question is, how do I know if I'm taking enough of something or if I need to add and combine? That's a tricky question, because it's very easy to look through all the information you can find online, talking to your friends, your peers, and they're telling you all the amazing things that they're taking. And the natural instinct is to go and get all of those things and take them as well. But you really have to look at what problem you're trying to solve in that. Do you need them all? Probably not. Can you overdo them? Very unlikely, but again, do you need them all? So while you can't necessarily take too much of a good thing and it be harmful to your overall health, it's just not going to be getting you any benefit.